Among this 50%, how to cross this barrier is what I'm going to tell you in this video. There is something called as an X factor these people have. I have seen many people, whoever is there in this 1% have that X factor. So that X factor, if you develop from the beginning, from the 0 years, you can quickly go through the filters and reach the 1%. I have seen some people at the age of 30s only they reach this top position. There are people at 50s not able to reach this position because the X factor is there in that 30s fellow who actually, which made him reach that position faster compared to other people. In this video, I'm going to tell you that. So this particular X factor has 5 elements to it, or 5 components to it. Component number 1 is they are usually masters in some rare or advanced skills which others don't have in the hospital. So they easily differentiate themselves in that particular hospital. So since I'm an anesthetist, I can easily give you some example. If some anesthetist is mastered in doing awake craniotomies, or if he's mastered in regional anesthesia, he would differentiate himself from other anesthesiologists who don't have that skills. So in that way, a clinician should differentiate himself from other people. And he should always answer the question, how am I different? Why should hospital actually, promote me to next levels? And everything, the answer to that is the mastery of some advanced skill which has some patient base. Okay, some skill which doesn't have any kind of relevance, if it is not solving any problem to the community, and that doesn't serve the purpose. Some number of patients also should be there for that skill. So I have done a video on is surgery dying? You can check out that video. I'll put that in the description also. Where in the surgery, many people are specializing in so many niches, but some niches have business, some don't have. Okay, I explained in that video, like minimal invasive surgery has a very good business model attached to that, because a lot of patients are having the problem and they come for that. Like that, you need to have skill which has a patient base or number of patients having that problem. Only then it will be valued. That is the component 1 of X factor. Then coming to component 2 is obviously leadership. The much needed skill is leadership. Leadership is more about taking charge of the crisis situation, or making a protocol for sepsis management and creating systems and processes in your place, or training juniors in trauma management, or something. You can take up any area. Ensure to the organization that you have leadership skills, and if you sit and wait for somebody to give you that, nobody is going to do that. Okay, you have to actually actively learn something and go to management or HR or some quality department and tell them that you have this skill, and you'll do it for free, and then they will organize that. So the hospital should see some kind of a leadership skills in you. So that is how you need to do. This is component number 2. Okay, or simple rota making in your organization also is a good leadership skill according to me, because it's a big headache. You can actually decrease work of your HOD and system will observe. So who is making the rota? If you have good clinical skills enough, you are also making the rota, you are valued in the department.